So what happens at the onset of exercise in pregnant women? So weight-supported exercise responses are generally unchanged. So that would be cycling. Weight-bearing exercise is going to be affected by body weight increases. So heart rate, stroke volume, blood pressure, and cardiac output may slightly decrease in the third trimester. We talked about reduced maternal glucose availability and reduced liver glycogen stores, reduced glycogen breakdown. So higher heart rate with resistance training. Blood pressure generally is unchanged. The responses would be unchanged compared to a normal adult. So what happens with the baby when the mom exercises? So there have been some studies, concern over core temperature with the mom's core temperature, which affects the fetal temperature. There does not really appear to be any effect. Now you have to keep in mind that doing research with pregnant women is somewhat challenging. Some IRBs, human subjects committees, don't always want to approve that, and you can understand why. There could be some small transient decreases in the amount of glucose the fetus takes in. The fetal heart rate can be affected by oxygen, but overall, the fetus's heart rate goes up with exercise along with the mom, so that's kind of interesting. The exercise and pregnancy outcomes. There is some controversy about that. Gosh, I recently saw a video about a pregnant mom doing CrossFit, and people were really upset about that, but clearly she's very trained and she's able to do that. You know, too much physical activity with too little energy intake may lead to a low birth weight, which can have complications. There typically tend to be smaller babies in recreational competitive athletes, but they don't mean too small. They mean babies that are on the smaller side of average. So I've heard some presenters at conferences refer to them as right-sized babies. There have been other studies that found increased birth weight with higher exercise. So another study found that physical activity less than 1 day and greater than 5 days may lead to lower birth weight. Less than 1 day may have something to do with nausea as well. Physical activity screening. Most facilities are going to require women to have some sort of clearance, physician clearance form while they are exercising while pregnant. Some do not care. There is the form called PARMEDx for pregnancy. So from the Canadian Society of Canadian Society Exercise Physiology and csep.ca, the first page is completed by the patient and then the healthcare provider, and then the physician can check off what the client is able to do and add comments to that. So it is a very good form if you take a look on the next couple slides. So this is a little tough to see here, but you can easily go to the csep.ca website and look at the form in more detail. It's also in the guidelines book, and I believe also in the chronic disease and disabilities book. So that is the first two parts that the patient fills out, and then you can see this and read this a little bit bigger. This is the section that is filled out by the physician. So it's very clear. They can mark yes or no that the patient is able to do these activities or not. Pregnancy exercise testing. Typically, we would not want to do testing. I mean, only if there's medically necessary testing required. If there is any type of maximal test needed, it should be done under the appropriate supervision, with the physician present. And in general, for an exercise program, the physician clearance is required, and the PARMEDx for pregnancy is a good indicator of that.